Good morning and welcome to Windsor-Essex County Health Unit's media briefing for Monday, November the 22nd. This morning we're joined with CEO Nicole Dupuis and Dr. Shankar Nasathuri. We're going to get started this morning right into media questions. So if we have any questions, we will start with Blackburn.
Thank you. I guess we know that the COVID-19 vaccine from Pfizer for children 5 to 11 has now arrived in the country. Have you heard when we might start getting the vaccination for kids here?
So why don't you comment, Nicole, and I can supplement that.
I think the provincial government put out an announcement as well on Friday, noting that they anticipate early next week, so early this week. So we are anxious to hear when we will get that supply. It is different than what we currently have. But we are ready to go. So all of our partners we've been prepping with, certainly our mass vaccination site has been preparing for 5 to 11. So as soon as the ministry, lets us know that we're ready to go, locally we'll provide that update and we'll be able to start. We're hoping that it'll be this week.
Okay, and I guess you mentioned that starting the rollout this week, I imagine you're ready to hit the ground running. You've been preparing for a couple of weeks now.
Did you want to start, Dr. Nasathuri?
Sure. We're always ready. That's one of the goals of, I think, in medicine and the public health service. So we knew that there would be a vaccine rollout to young people. We just don't know the exact date of the authorization or from the province. Once we receive that information, we will be ready to roll out vaccine to children ages 5 to 11 through multiple distribution channels, community vaccination centers, physicians' offices, and try to do that in an expeditious and timely manner.
Do you anticipate using schools?
So we currently, we have been in schools to provide COVID vaccination, certainly, in August and through September, we did work with our school-based partners to offer COVID-19 vaccination in the schools. Right now, we have multiple priorities. So we have our regular school-based vaccinations that we're trying to catch up. So those would be the school-based vaccinations that were delayed because we were not able to get to them in 2020. So our team is actively out in schools right now. With those vaccinations, we will work with our school partners to ensure that there's opportunities that we don't miss any opportunities for access, and that can include school-based vaccination clinics for COVID, in the coming months.
And last question, do we know how many kids you anticipate you need to vaccinate?
Do you have the exact number? We can probably get you the exact number. It's in the thousands for sure. I think it's the distribution of school-age children who are 5 to 11. We can probably give a projection or an estimate of that number.
Yeah, I don't have the exact number at my fingertips at the moment, but it's I believe greater than 30,000.
Thank you.
Any questions from Windsor Star?
Just to clarify what you said, Nicole, does the region already have its supply of vaccinations for 5 to 11, and you're just waiting for the green light from the province to start doing it, or you have to wait for shipments?
Both, yeah. So we're just waiting for the shipments, as well as, that'll be part of that green light. So we're waiting for both certainly the province has acknowledged the announcement of 5 to 11. And now we're just waiting for the actual vaccination or the vaccine supply that we'll be able to get started. The pediatric dose is different than what we have on site and within our storage for adults.
Have you received indication from the province that receiving that supply will be a smooth process, one that will happen quickly, or are there any concerns there?
I don't have any concerns. We, haven't had any challenges over the course of the pandemic. Things have moved rather smoothly, so I think we're hopeful that this will be a smooth process as well.
Thank you.
Any questions from AM 800?
In terms of the childhood vaccinations, I got my answers, but I got one more. We were made aware of some additional COVID cases at St. Joseph School in River Canard, and I'm just wondering if there's an update potentially on the outbreak there, if it's gotten any worse.
So always there's a lot of activity that happens over the weekend. We wouldn't be able to comment on any, any cases that have come in on the weekend or any expansion of any outbreak. We certainly can provide an update. If you, again, wanted to send us that question, we can try to get an answer and provide an update. Or, at our next YouTube, we can provide a better update where we're at with some of our school outbreaks.
Okay, thank you.
Any questions from CTV?
Yes, good morning. What is your message to parents about getting younger children vaccinated?
Well, I think that the message is an important one. First, if you get your child vaccinated, they're less likely to acquire COVID. If you get your child vaccinated, they're less likely to infect someone else with COVID. If a large group of children get vaccinated, we're less likely to see transmission in COVID in schools, and that'll decrease the likelihood of cohort closures or cohort dismissals, which means that more children will be able to stay in school. It'll decrease the chances of entire school closures, which means that, again, more children will get an opportunity to stay in school. It also breaks the chain of transmission, which means that when you vaccinate your child, you're helping your mom, the mom and dad in that family, and also the grandparents and other vulnerable people. So if a large group of young people get vaccinated, that means they can't get COVID for the most part, or their chances are less. And then they can't transmit, reduces the chance of transmission to mom and dad, and that reduces the chance of transmission to grandma or grandpa, and that reduces the chances of the disease making its way into a long-term care facility or a retirement home or another vulnerable person. So when one vaccinates their child, they vaccinate the child for their own benefit, for the child's benefit. They vaccinate the child for the family's benefit, and they vaccinate the child for the broader community's benefit. This is the cornerstone of vaccination that we have for all other vaccines. Where we vaccinate young people in Ontario, we're vaccinating for their benefit, and we're also vaccinating for community benefit. It is a part of civic participation to get your children vaccinated, and the risks versus benefits clearly weigh vaccinating your child.
Thank you. I wanted to ask about the WeVax campaign. Do you think it had the desired effect, as in did more people get the shot because of it?
That's a difficult question to answer because it's an evaluation question. I think we can't pinpoint an increase or an uptake of vaccination from any one specific effort, but certainly, certainly the WeVax campaign helped to amplify the message. It helped to simplify information to one source. So we do, anecdotally feel that it was successful, but as far as, any type of evaluation or data that would say any one activity that we've had has been, increased or contributed, we wouldn't be able to specifically say that. But, I did also want to just add that I did verify the number of children 5 to 11 is 33,000 locally. So it's pretty close.
Great, thank you.
Any questions from CBC?
Yes. Do you have a sense of what the initial vaccine supply will be?
Yeah, to answer this, what we've heard up to this point is that the province has ordered more than enough vaccine or sufficient vaccine for all the people that are eligible. I don't really expect that we'll have any supply chain issues for the distribution of vaccine. That's our assessment at this point. The province, to its credit, has an organized system of acquiring vaccine and distributing it, and we've been doing it for decades. It's not a new, like Ontario has a very good, well-organized vaccine distribution program. So I don't anticipate any problems with getting the necessary vaccine to get people vaccinated.
Thank you. And the provincial government says that school boards can move toward regular semesters in February or sooner if local health units allow it. Is that something that you would allow if the boards express, I guess, support for abandoning the quadmester model sooner than later?
Well, the first thing I'd say is the most important thing from the public health services perspective is to keep schools open for instruction, meaning for kids to actually learn from their teachers. That's the most important thing. And we know that young people have suffered disproportionately because of school closures, classroom dismissals. We've dismissed about 450 cohorts of young people. And if you think there's probably 20 people in a cohort, it's 9,000 children. 9,000 children have been affected by COVID exposures in schools. Secondly, as you add to the strategy in a school is really is substantively three components. One is to reduce the risk in the community overall. If there are no cases in the community overall, then there are no cases that can make it to the school. The second is is to screen at the door, meaning that you may do vigorous efforts to make sure that young people who are infected with COVID don't make their way into the school campus. And that requires both parents and the school board officials to work together. And then if it does make it into the school class, that it is recognized quickly and all the exposures are contained. That's why we dismiss young people from school if there's an exposure. And if it is in a class, to make sure that it doesn't spread through multiple classes in a school. Now, this is where adding going to 4 classes a day versus 1 class or 2 classes changes, because once COVID makes it into the school, once all those different layers of protection have been breached, once it makes its way into the school, then the more young people that are potentially exposed, the more kids are going to be dismissed from school. So it's a balancing act. Is that as you have more interactions in the school, so going from 1 class to 4 classes, or 2 classes to 4 classes, whatever that might be, you also increase the number of people that are exposed. So you may improve the education, which is clearly improved by having more classes, but the consequence of that risk-benefit decision is that you may end up dismissing more kids from school and closing more schools. So that's sort of the policy choice, policy decision-making. Now, the one thing that would modulate this is if we had 95 or 97% vaccination in schools. Because when we get to that level of vaccination, then one can reevaluate what public health measures you need, even if a case breaches into a school. We're far from that. It's another reason why families should try to vaccinate or really consider vaccinating their children. Now, to the substantive question which you asked, and I'm sorry for that long-winded preamble, we have to work with it. We would meet with the school board at least, I just look at my calendar, at least once a week. We have managing the public health component is a joint responsibility between the public health service and the school board and school board officials. And we'll continue to have discussions with them and try to make the best decisions we can. Right now, the burden of COVID is still pretty significant in schools in Windsor-Essex. It's still significant in the community. And Windsor-Essex has suffered disproportionately compared to other provinces as it relates to school-related cases and school-related closures. So all of those things will weigh in our decision-making. I have not made any firm recommendations up to this point. But we'll continue to evaluate and then make our best decision moving forward.
Thanks very much.
You're welcome.
Do we have any follow-up questions from Blackburn?
Yes, I just wanted to ask, because I know that St. Gabriel Catholic Elementary School is closed right now. St. Joseph's has 5 confirmed cases right now. It also has an outbreak. It has the same number of classes dismissed. I guess, is there any plan at this point to shut down St. Joseph's as well? At what point do you move to that? I know that you want to keep schools open, but of course, the burden of illness is obviously very high there too.
So I'll start. Again, Monday morning is a busy morning for us. We've just started, and so additional activity that occurs over the weekend, our team, meets and discusses, all outbreaks, including schools. So, and we have those conversations daily. Some of the indicators we use is the percentage of the school, so the size of the school. So as well, you can't really compare each scenario and each situation is unique. So there are a lot of factors such as, you could have multiple cohorts dismissed that are related to one household where they're siblings. So, it's really difficult to look at it at face value and compare one school to another. But we do, discuss those daily and make the best decisions certainly for the schools in collaboration with our medical officer of health. And I'm sure Dr. Nestle will want to add, but it would be hard for us to comment this morning when we haven't, yet met with our team to look at where we're at with each scenario.
Okay.
Yeah, if I could add, and just an observation, if it's not uncommon for patients to try to understand why their cancer is treated some differently than someone else's cancer, despite that both might have colon cancer or they both might have breast cancer. Because in medicine, there are many more variables than the diagnosis itself. There's the age, pathology, response to previous treatment, patient preferences, and that can't be summarized by a few words. And many times it's complicated by the variables that one has to consider. The same is true in public health practice. The decision about what the public health management should be when you see a number of cases together varies based on a number of factors, like where do we think the exposures were, how many classes were actually affected, was there a school bus or not as a potential source of exposure, was there an activity outside the school that was potentially connected, and then there are administrative organizational items, which is can the school board, can the school district properly staff a school based on the number of potential teachers that have been affected? What is the quality of the educational experience that you can give when you have the professional staff of the school excluded in large numbers? All of those weigh into the decision making on allowing a school or recommending a school continue with its educational activities or not continue with its activities. And the goal is strategic, which is it better to close the school early or earlier so that you don't have widespread dissemination of disease, or is it better to allow the school to continue to function, accepting the risk that more cases may become apparent? And that's why it's complicated. We don't always have all the information on Monday morning to tell you that, and sometimes they reflect on also a lot of confidential items which we cannot disclose. So sorry for that long-winded response, but that's sort of how I hopefully provide some context.
Thank you. It does.
And any additional questions from Windsor Star?
No, thank you.
Any additional questions from AM 800?
No, I'm good, thanks.
Thank you. Any additional questions from CTV?
No, thank you.
And any additional questions from CBC?
No, thank you.
All right. Thank you very much, everybody. Have a wonderful Monday, and we'll meet again on Wednesday.
Thank you.
Thank you.
Thanks very
All
much.
the best.